According to the American Heart Association, AHA, heart failure is not exactly like the name sounds. From the name you would assume it is what occurs when the heart fails and stops working completely. The actual meaning is that the heart isn't pumping blood as it should. Heart failure is also known as congestive heart failure. The two terms can be used interchangeably, but for the purpose of this post we will stick to heart failure. Heart failure is when the heart muscles are unable to pump sufficient blood to supply the body with the oxygen and nutrient-filled blood it requires. Biologically, the heart tries to fix this situation by either enlarging, developing more muscle mass, or pumping faster in order to keep up with its workload and supply sufficient blood to the body. The body also tries to compensate for heart failure by reducing the amount of blood that gets to some parts of the body.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Michael. Today Russell and I will be covering everything you need to know about heart failure, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. Okay Russell, please give us a bit more of an overview of what heart failure actually is.
The pumping action of the heart is how the body receives oxygen and nutrient-filled blood. When the heart is weak and unable to sufficiently pump blood to other body parts and nourish the cells with nutrients and oxygen, the person is said to have heart failure. The result of this could be shortness of breath, fatigue and coughing. This can make simple tasks like lifting an object really difficult. Heart failure is a serious condition that requires immediate medical attention. It has no cure, but it is optimally manageable and the patients can lead a relatively long, healthy life. Before we take a deep dive into the symptoms, types and causes of heart failure, you first have to understand a few basic things about heart failure. It can affect either the right or left side of the heart or both sides. Heart failure can either be a short-term condition/acute, or an ongoing condition/chronic condition.
What are the symptoms of heart failure?
Symptoms of heart failure could include persistent coughing or wheezing with pink or white blood-stained phlegm or foamy mucus, loss of appetite and nausea, fatigue, unexpected weight gains from fluid retention, uneven and rapid pulse, heart palpitations, protruded neck veins, swellings of the ankles and legs or edema, shortness of breath or dyspnea. This usually occurs when you lie down or when you've exerted yourself. Swelling of the abdomen or ascites. Excessive desire to urinate at night. Reduced concentration ability. Fainting. Chest pain, especially if the heart failure stems from heart attack. Congested lungs from fluid buildup which eventually leads to shortness of breath. These symptoms may be an indication of a weak heart. Some of them, like fainting or severe chest pain, are indications you should seek immediate attention from a medical professional.
What are the causes of heart failure?
Heart failure can occur on either your right, left or both sides of your heart. Heart failure can either be diastolic or systolic. 1. Left-sided heart failure is the most common type of heart failure. It occurs when the left ventricle fails to pump blood as efficiently as it should. The left heart ventricle, usually located at the bottom left of the heart, is responsible for pumping oxygen-filled blood to other parts of the body. This type of HF is caused by the inability of the left ventricle to pump needed blood. Blood often backs up into the lungs, causing fluid retention and shortness of breath. 2. Right-sided heart failure occurs when the right side of the heart is unable to function properly or effectively. The right ventricle is primarily meant to pump blood to the lungs in order to collect oxygen. Right-sided HF is also triggered by the failure of the heart's left side. Buildup of blood in the lungs caused by the left ventricle's failure causes the right side to work overtime, and this stresses the right side and eventually leads to heart failure. Conditions like lung diseases can also lead to right-sided HF. One common sign you'll observe is swellings of the abdomen, feet or legs caused by fluid buildup. 3. Diastolic heart failure is another common type. It happens when the muscles of the heart become stiffer than normal. This stiffness indicates that the heart is not easily filled up with blood, and this is usually caused by heart disease. This condition is referred to as a diastolic dysfunction, and it causes lack of blood supply to other body parts or organs in the body. This HF is more common in women than men. 4. Systolic heart failure is what happens when the heart loses its ability to contract. The pumping action of the heart is only made possible due to contractions. Therefore, these contractions are primarily responsible for blood pumps and distribution of blood, oxygen, and nutrient. This inability to contract is usually caused by a weak or an enlarged heart. This type of HF is more common in men than in women, and it's also known as a systolic dysfunction. The diastolic or systolic HF can occur on either side of the heart. Heart failure is more often caused by or related to another disease or health condition. Coronary artery disease (CAD) is the most common cause of heart failure. CAD is a disorder that causes arteries that supply oxygen-filled blood to the heart to narrow. Heart attack is another condition that is related to heart failure. Others include heart valve disease, high blood pressure, HIV/AIDS, severe anemia, chemotherapy, and alcoholism. The list of possible causes are numerous, and that is an indication of how important but delicate the heart is. Some other causes include diabetes, cardiomyopathy, a heart muscle disorder that causes heart weakness, congenital heart defect, lung diseases like emphysema, underactive or overactive thyroid, hypothyroidism and hyperthyroidism, irregular heartbeat rates or heart arrhythmias, myocarditis, faulty heart valves, and drug abuse. It is important to check with your doctor if you're associated with any of the above for medical attention.
What are the risk factors that may lead to heart failure?
A single factor may cause heart failure, but some can come as a combination of two or more risk factors. Factors that may put you at risk of heart failure include race. People from certain races are more predisposed to heart failure. Africans are at the highest risk of having heart failure. Sex. Men have higher chances of having HF than women. Sedentary or passive lifestyle. Heart attack. Diabetes and certain diabetes medications. High blood pressure and coronary artery disease. Alcoholism and tobacco usage. Viral infection. Sleep apnea. Obesity. Bad diet, such as taking food high in fat and cholesterol. Certain drug types used to treat cancer, high blood pressure, blood, lung, neurological and psychiatric conditions, as well as certain anesthesia medications. Heart arrhythmias or irregular heartbeats. Valvular heart diseases. Heart failure. Even though it isn't the total failure of your heart like I mentioned earlier, it does cause severe health complications like kidney damage/failure, liver damage, and many others.
How is a heart failure diagnosed?
During your meeting with your doctor, he/she is likely to ask you certain questions about your medical history and your symptoms. Your medical history is to determine if you have any pre-existing conditions that could cause heart failure. You will also be asked about your lifestyle, like whether you drink or smoke or lead a sedentary lifestyle. Several tests can also be taken if the doctor needs to find out more information. These tests include heart MRI, chest X-ray, ECG, an electrocardiogram to measure the electrical activity of the heart. Nuclear scan, a little quantity of radioactive material is infused in the body to create images of the heart on a scanner. Stress exam. Catheterization. Holter monitoring. However, an echocardiogram is the best way to diagnose heart failures. The doctor can analyze the problems with the heart using detailed pictures gotten using sound waves. The cause of the condition can also be analyzed this way. This test can also be done with the tests I mentioned earlier or physical tests or exams for a more detailed result.
What are the available treatment options for someone with a heart failure?
Heart failure, as a condition, is best treated as soon as you begin to notice symptoms. The treatment often depends on the severity of the condition. Like I said before, there is no cure for heart failure, but early treatment will improve the symptoms tremendously. Keep in mind that the goal is to improve the patient's lifespan with the treatment plan. Regular testing of about 3 to 6 months is greatly advised. At the early stages of heart failure, medications can be used to reduce symptoms and stop the condition from getting worse. Medications like those taken to reduce cholesterol levels, to remove or reduce blood clots, remove excess sodium and improve potassium levels, all improve the heart's pumping action and reduce heart rate when required. Surgery can also be a treatment plan for people who need immediate action. It is a plan often recommended by doctors when it becomes necessary. The surgery can include coronary bypass, angioplasty, pacemakers, or even a heart transplant.
What can we do to prevent having a heart failure?
You must know by now that prevention is always better than cure, or in this case a treatment plan and no cure. I cannot overemphasize how important healthy living is to your heart as the body's most vital organ. There are a couple of preventive measures to consider in order to completely avoid the risk of suffering from heart failure. These include controlling and managing high blood pressure, maintaining a healthy diet by avoiding fatty meals or foods with high cholesterol, controlling and managing diabetic conditions, exercising regularly and maintaining a physically active lifestyle, maintaining a healthy weight, adequate sleep, reducing or quitting alcohol, reducing or quitting smoking, effectively managing or reducing stress levels. Heart failure is one of the leading causes of death globally. It is often very fatal and must therefore be given utmost attention. Again, the best way to prevent the heart failure is to live a healthy life.
Thank you again, Russell, for helping our viewers better understand heart failure. To our viewers, remember to share this video with someone who may benefit from the information. Also leave your feedback and topic suggestions in the comments section. See you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.